Hello, this is Dr. Paul Ingmanson. I'm the Director of Sleep Laboratory Services at the VA Hospital in San Antonio, Texas, and I'm here to talk with you about healthy sleep and how you can get the best rest of your life for the rest of your life. In part 3 of this series, we're going to talk a little about breathing problems during sleep. Now, please take out a pad of paper, the pad that you took notes on in sessions 1 and 2, and use this during this segment. Breathing problems are the most common reason people get referred for overnight sleep testing, either at home or in the sleep laboratory. Breathing problems are very common. The most common breathing problem that occurs during sleep is what's called obstructive sleep apnea. This is a problem that may affect as many as 25% of Americans. What are some of the symptoms of sleep apnea? People with sleep apnea generally describe their sleep as non-restorative. They don't feel rested when they wake up. They wake up and feel as though they're as tired as when they went to bed. Sometimes other symptoms will come up, things like morning headaches, feeling chronically sleepy during the day, and there are often mood-related symptoms. People with sleep apnea may feel depressed or irritable during the day because of insufficient sleep. They may also have problems with concentration and memory that interfere with their ability to do tests that require sustained attention or alertness during the day. These are all symptoms of obstructive sleep apnea. What are some of the signs that we observe when we are trying to detect obstructive sleep apnea? Loud or irregular snoring is an important sign of sleep apnea. As many as 30% of adults snore. Snoring is an important sign of obstructive sleep apnea, but not everyone who snores has sleep apnea. Some snoring may be considered normal. In some cases, snoring may disturb a bed partner, but not necessarily be a sign of disease. But when snoring is loud, and especially when it's irregular, it may be a sign of an interruption in airflow during sleep, and this indicates the possibility of more serious problems, such as obstructive sleep apnea, that may require medical attention. Here's an illustration of normal breathing during sleep. Air passes through the nose and goes down through the upper airway to the lungs. When we are awake during the day, the muscles in the upper airway will generally maintain sufficient tone so we can breathe normally. Breathing during sleep is more complicated for two reasons. Muscle tone tends to decrease as we relax and fall asleep, and when we get horizontal in bed, gravity is working against us. As we fall asleep, the muscles in the body relax, including the muscles in the upper airway. When those muscles relax and vibrate, that's what other people hear as snoring. Notice the floppy structure in the back of the throat, called the soft palate. This structure tends to relax during sleep. When it relaxes to the point where it starts vibrating, this is what other people hear as snoring. In this picture, you can see that the soft palate and tongue have fallen back so that no air can pass down to the lungs. When no air can pass to the lungs, oxygen in the bloodstream starts to drop, and when you can't breathe out, carbon dioxide starts to build up in the bloodstream until the brain gets a signal that says, wake up, and then you make a noise like and start breathing again. That can happen dozens or hundreds of times during the night without a person being aware of it. That can make you sleepy during the day because your sleep is interrupted repeatedly at night. That can also increase your risk for high blood pressure, heart disease, and stroke. Your heart and your brain need oxygen. When you breathe in, you release carbon dioxide when you breathe out. Breathing is good and not breathing is not good. Doctors agree on that. They teach that in medical school. Now let's take a minute and look at an example of what's involved in a sleep test. We have a very famous sleep apnea patient here. You may recognize Shaquille O'Neal, the recently retired National Basketball Association player. Shaq started his career with the Orlando Magic in 1992 and went on to a Hall of Fame career, winning 3 consecutive championships with the Los Angeles Lakers and then a 4th championship with the Miami Heat before playing his last season with the Boston Celtics in 2010-2011. The Celtics actually retained Dr. Charles Zeisler, a prominent physician at Harvard Medical School and a world-renowned expert in sleep medicine, as a consultant to help their players get the sleep they needed for optimal performance. In this video, Shaq is going to walk through the process of getting diagnosed with sleep apnea, starting with listening to his girlfriend, Nikki Alexander, complaining about his snoring. Shaq decides he needs to discuss his snoring problem with the Celtics team sleep specialist, Dr. Zeisler, whom you will see Shaq affectionately refer to as Dr. C. Dr. Zeisler and his colleagues work with Shaq to diagnose his problem and find a solution. Let's take a look and see how Shaq attacks sleep apnea.
I snore?
Yeah.
See, I don't know if I snore because I don't hear myself, so.
Oh, he hears himself because sometimes it wakes him up. And he's like, baby, was I snoring? Yeah, you were snoring. It usually happens when he's on his back, and then he gets into that deep snore like it's deep. And then he stops. His chest would stop moving and everything, like he was not breathing. So I nudged him like, babe, wake up. And then he'd catch his breath. I'm like, dude, you just stopped breathing in your sleep. And I saved him.
Pam's a registered polysomnographic technician.
Poly what?
Polysomnographic means sleep study. She'll be the one putting the electrodes in.
Sleep apnea actually is a pretty common condition, which is most likely underdiagnosed and underevaluated because many people don't realize that they have it.
Well, every time I stop breathing, the next morning, yeah, sleep apnea. Yeah, sleep apnea. And I'm like, what is sleep apnea?
Well, sleep apnea is a condition where a person is unable to get air into their lungs when they fall asleep.
Every time the person stops breathing, they wake up. They stop breathing, they wake up.
And that exposes the body to a myriad of really adverse stresses.
And that does have consequences.
Irritability, can't focus and maintain attention.
They're unable to sleep in the same bedroom with their bed partner or spouse.
There's about a 7-fold increased risk of motor vehicle accidents.
It's linked with the obesity epidemic, to being linked with cardiovascular or heart disease.
High rates of stroke, diabetes, and even mortality.
And so now we got to fix it. Don't want to go out like that.
So, Shaq, one of the things that we talked
I'm meeting with the sleep doctor, my main man, Dr. C. He said he wanted me to be part of his sleep study.
We arranged for an overnight recording in which we could actually find out whether Mr. O'Neill has sleep apnea.
So tonight, electrodes on the head, and they're going to study the brain waves. Hopefully my REMs and my non-REMs. See, I read that, my rapid eye movements.
Oh, and the end is the what?
Non-rapid eye movements. So, hopefully I don't have it, but if I do have it, I know I'm working with the best people to, get it cured.
You all ready to go to sleep?
Yes, sir.
Okay, good luck with everything. We'll be here monitoring.
So the evaluation of sleep apnea is a test while they're asleep. And every second of the study will be looked at, and then the physician will interpret it and make a conclusion.
To cut to the chase, you have moderate sleep apnea here.
Obstructive sleep apnea is a chronic condition which is eminently treatable.
All right, so you said there's mask, the mouthpiece, and surgery.
Correct. The treatment of choice as of today for sleep apnea is to go ahead with nasal CPAP, the mask.
And is this forever treatment or just a 6-week thing?
We generally regard this as lifelong treatment.
Getting a mask to fit effectively is often a cardinal part of effective treatment.
You have a mask here that I can look at?
If a person is able to use the CPAP device, it works almost 100% of the time.
Oh yeah, this is pretty good. This is nice, I like it. Can I wear it to the club?
Yeah, absolutely.
Oh, this is nice.
Okay,
I like
good.
it. I'll do it. Since I've met with Dr. C, and I've been getting at least 7, 8, 9 hours of sleep a day. Feel good. The weight is good. Got a lot of energy. The relationship is good at the house. Everything is working.
This video offers a nice illustration of the experience of learning about sleep apnea and how to deal with it effectively. Shaq's experience is similar to the experience of many patients. A lot of people are not aware of their snoring problem, but they'll have it brought to their attention by a bed partner. That was the case for Shaq. He then had the opportunity to visit with Dr. Zeisler, the team's sleep specialist, who helped explain what might be going on, and then went for an overnight sleep test. After the test, Shaq had a discussion with his doctor about the 3 kinds of treatments for sleep apnea: an air pressure device called CPAP, a dental device, and surgery. And he elected to solve his sleep problem with CPAP. CPAP is generally regarded as the safest and most effective treatment for patients with obstructive sleep apnea. Now, take out a pad of paper and write down the answers to these questions. Do you ever notice yourself or your partner's breathing stop during sleep? Write down your observations and discuss them with your healthcare provider. Have you ever awakened choking or gasping, or has someone else observed you stop breathing during sleep? Again, if that's the case, you may have sleep apnea. So take a moment and write down your answer. And again, you may want to discuss this in a later visit with your healthcare provider. I'll pause again for a few seconds here so you can write down 2 or 3 other things you've learned about sleep from this video or the materials in the VMC library. So in this segment, we have learned something about sleep apnea, one of the most common sleep disorders that comes to medical attention. To learn about other sleep problems and how to solve them, be sure to watch the other videos in this Sleep 101 series and check out additional sleep materials in the VMC library. Thank you very much.